Try and find it.
I know, right?
Ready? Come on.
Okay. So my name is Stephanie Landis from Child Welfare. My job title is Community Liaison. It's just kind of just a fancy name for I spend a lot of time on the hotline. Okay, so there's 4 of us on our team, and the job responsibilities we have is answering the hotline. So if you do need to make a report, you have like 25% chance of getting the answer on the phone. Hopefully I'm nice. We also have the responsibility of doing institutional investigations. Okay, so there is abuse or neglect coming out of daycares, out of foster homes, out of Grand Mesa Youth Services Center, Hilltop RYS, those kinds of places. We do those assessments, and then we also do any fatality and near fatality assessments as well. So that's what we do on the team that I am from. So when I'm going through this is really just a general, like basic entry level identifying like red flags that you're seeing, and then how to make a report and what happens after that. Okay, so some of this may be like very basic, you're like, duh, everybody knows that. Some people don't, all right? So it's very basic. If you have questions, definitely you can interrupt any time and ask, and I'll do my best to answer them. And as I'm going through, like I said, it's a basic entry-level abuse and neglect. And a lot of it is just very interfamilial, okay? Like when you think of child welfare, I mean, I think of the families that get involved with us, not the institutions. But I'm going to try to give examples of what institutional abuse and neglect would be, along with some of these interfamilial. Because as mandated reporters, not only are you around kids here that you may need to make reports on, you're also maybe seeing some things in your personal life that you might need to make a report on as well. Okay? So, we're just going to dive in. So we're going to define all the 3 different types of abuse, which we have physical, sexual, and emotional, and then neglect, which encompasses all the other stuff that can happen. And like I said, we're going to talk about being a mandated reporter, how you make reports, what your obligations, what your duties are. Okay. So this is some law taught by someone who never went to law school. This is the Children's Code. All right. So this child welfare is a civil system. Okay. This is a children's code, so this is not the criminal code. This is not the criminal definition of child abuse. This is how it's defined in the children's code, okay? So we have this little line in the sand that says discipline. In Colorado, you can physically discipline your child. You can use corporal punishment. The line in the sand is when that discipline leaves some kind of lasting injury to that child, okay? So you have a mouthy teenager, mom decides to smack him in the face, okay? There's no injury, that would be discipline, okay? I know, some people are like, oh my gosh. But that's the line, okay? Same scenario, mom slaps them in the mouth, and their tooth cuts their lip, they have a bloody lip, you have an injury. So it's a fine line, but those 2 same incidents can be discipline versus abuse, okay? So like, you can spank your child with a belt in the state of Colorado, it's allowed. Okay, you spank your child with a belt, there's no bruising, that's discipline. If you have injuries on the child, it's abuse, okay? So that's how we're going to differentiate between the 2. So, as I go through these different types of abuse and neglect, I'm going to go over indicators. Okay, so those are our little red flags that we're going to be like, I'm a little bit concerned about that, or I want you to be able to see these things and maybe be like, okay, I'm going to look at that differently. Now I'm worried about that. So kids, you guys spend all day around them. Like, kids get bruises, right? Like, all the time. It's very normal for kids to have bruises, especially the really active ones that are outside playing. Okay, so if you see a bruise on a 3-month-old, is that normal?
No.
Why?
They're not that active.
Sometimes 3-month-old aren't even like moving at all, right? So if the child isn't moving, they should not have any bruises. Okay? So you're talking about toddlers. Like, they're clumsy, like they're falling down, they're getting hurt all the time. So there's places on your body that are normal to have bruising, and there's places on your body that are focused on in an active discipline, which, like I said, that line in the sand that can cross over to abuse. So if you think about when kids are playing, falling, you're going to see all these bruises like on their shins, like their elbows, their knees. Like if you got your little toddlers, they're gonna catch the edge of a table. Exactly, okay? So those places are those are pretty normal to have bruises, okay? If you are seeing bruises on the backs of the thighs, the butt, the lower back, the stomach, the ear, those are not normal places that kids usually get bruises in playing, okay? So especially if those bruises have patterns to them, okay? Because usually when kids are falling, they have like those little round ones. There's not really any pattern to them. If you're seeing like straight line type bruises, if you're seeing loops, different patterns, burns, okay, then that's very indicative of abuse. Okay, so backs of thighs, butt, lower back. The stomach is a very hard place to bruise. Okay, so if you're seeing bruises on the stomach, it's very concerning. We went out on an institutional many years ago because this child had bruises, little bruises on his stomach. Okay, so we're worried because that's a hard place to bruise. You have a lot of internal organs there. And come to find out, he was spending a lot of time on the slip and slide, and there was like little pieces of gravel under the slip and slide. Okay, so it ended up not being abuse, but absolutely a valid report because these little ones, they can't tell you what happened, right? So if you're seeing injuries on kids and they are verbal, the way that you ask them is very important. You don't want to ask in a leading way. You see a handprint on the kid's face and you're like, who slapped you? Or your mom slapped you. Like, I'm telling the kid what happened, right? We don't want to do that. You can just simply ask, hey, it looks like it hurts, what happened? Just a very open-ended question, okay? If you've got your little ones that can't speak, then you're probably just going to need to make a report if you see some kind of pattern, bruising, injury, burn, something like that on the child, okay? And the bruises in different stages of healing, so multiple colors. So you got green, you got blue. That's happening at different times, so it's more than an isolated incident. So like I said, ask an open-ended question, and it's helpful to even know like what you think. Like when you ask a child a question, sometimes you know these kids really well. Maybe you've known them for years, and you have a really good indication of when they're being truthful, when they're not. So you're like, yeah, I asked them, and they said, they fell off their bike, but, I don't believe it because they just looked down, they wouldn't make eye contact, they, whatever you're seeing in the body language that makes you maybe not believe the explanation, because we have had kids that have been abused for a long time because they're always coached into giving these certain explanations, and sometimes they just don't match up. So if you are like, well, they said it was an accident, I don't know if I should make a report or not, but I don't believe what they're saying, then yeah, why not make a report and just include your opinion, because we're going to ask for your opinion. These are some other indicators. So I have some pictures here. Can you guys see them?
It's a square.
Okay, yeah, so you see that very sharp 90-degree angle. So we got a pattern. This is the back of the thigh. Do you guys have any idea what would have caused that injury?
Could have been a belt buckle, or
So it's actually a 2x4.
So what do you think? I was thinking a spatula.
A spatula?
Yeah, 2x4.
Yeah. Wow, this is a 2x4. This one's a little harder to see.
Is it a handprint?
You see that?
Yeah.
Okay. So this is a belt.
Got it. Ouch. Yikes. Oh my word.
What do you guys think this is?
Bite mark.
Okay. Bite mark. Why are we concerned about this bite mark?
This is huge.
Big bite. So this isn't like the 2-year-old at the daycare is going through the biting phase, right? Some parents, they discipline their kids when they go through that biting phase by biting them back, right? To each their own. But this crosses that line in the sand because we have this lasting injury.
Try to eat your kid. Oh my gosh.
Ear is a very hard place to bruise. Okay, so this kid got their ear yanked on pretty hard. Like I said, that can be a focus of discipline. Parents can yank on that ear. If you ever see bruising back here, that can mean bleeding on the brain. So it's can be very, very serious behind kind of does look like scratch marks, but these are actually like kind of like welts. So parents will sometimes discipline with whatever they can grab that's closest, and sometimes it's a cord. Just grab that cord. This child got whipped with a cord. Okay, so something.
That's a diaper.
Yeah,
So that is
that's
a
a
little
baby.
one.
Do I have any smokers in here? Sorry to call you out if you are. But, so I'm not a smoker, and something that I learned is that, you know, if you're just lighting a cigarette, that lighter is not hot enough to cause that burn. Okay, this is a very purposeful injury, because you have to sit there and hold that lighter for about a minute to get it hot enough to burn like that.
Let's test it out. Sally?
Hey, not today. Not today. Oh, it's a hand.
You can see here, I have a second picture of this one, it makes it a little bit better.
Are these your own pictures?
These are not my own personal pictures, no.
Are these like in the Corner Valley?
Yes. Dang it. So this is the buckle part of the belt. If you can see that center spot and that pattern. So we can't show faces, so that's why it's like close up and kind of blurry.
No, that's close to your eye. That's so not okay.
So what happened here?
Smacked in the face.
Yeah. When you get slapped really hard, the blood will actually make an outline of your hand. Okay, so that's everything on physical abuse that I have. There's a lot more, but that's what I have. Do you guys have any questions about that?
No questions, but I had a little boy in my classroom who showed signs of abuse, and come to find out he had a blood condition to where his platelet count was so low. I mean, the mom took him to the doctor, and the doctor was like immediately called it in, and yeah, he had a blood condition that caused him to bruise so easily, and of course we were all really freaked out, but it ended up being something that wasn't abuse.
Yeah.
So
Yeah, and that absolutely happens. We'll go out and we'll assess a situation that it's like, oh my gosh, this child's getting beat really bad, and it's not abuse at all.
yeah.
Okay, so that's why we go out, we do an assessment to figure out what's happening, what's causing the injuries. So yeah, that can happen for sure. All right, so ready to move on? Okay, emotional abuse. This one is the hardest one to be able to prove. Okay, when I'm talking about physical abuse, you have something that you can see, you have this tangible injury. Emotional abuse is, it's all this gray area, and you have to be able to prove this substantial psychiatric impairment to the child. So this is not simple name calling. Okay, so we'll get people calling in, and you hear them calling their kids names, which, that's very poor parenting. But for us to classify it as emotional abuse, we have to prove that substantial psychological impairment. Okay, so you have like a suicidal child, parents berating, putting down, you're so worthless, you might as well just go kill yourself, child follows through and attempts suicide or something like that. You've got that substantial psychological impairment. Okay, so if you're seeing, if you have concerns about a child for some other reasons, but you also, mom calls them a little, I don't know if you guys are cool with 4-letter words in here, calling them cuss words or whatever it may be, definitely tell us about it. Like if you're concerned, it's I am seeing a change in this child's behavior, and I think it's because of this. I've heard mom say this, I've heard, whatever it is, okay? So we can get, if you're concerned enough to make a report about it, then we want to hear about it. Some indicators of emotional abuse. Just because a child has one of these things doesn't mean that they're being abused or neglected. I'm sure that you might even know children with some of this stuff that you have no concerns about, right? You know that they're very, very well cared for. Failure to thrive, that's a medical definition. We are going to be reliant on medical professionals to make that diagnosis. After a child reaches their growth curve, they fall 80% below. That's not something that I can diagnose myself. Who has seen a hyper or disruptive kid?
We're all disruptive.
Right? Isn't that your whole day? Hyper disruptive kids. So when I'm talking about these kinds of indicators, you know, you kind of have a bell curve of children's behavior. You just spend a lot of time around kids, so you can spot those ones that are definitely on the outside of that bell curve. Okay, so very, very, very hyper, very, very disruptive. And sometimes, you know, we have a medical diagnosis, a medical condition that can be somewhat responsible for that kind of behavior. We have your ADD or ADHD kids. Flat affect, you know, do you have any of those kids? Just don't really get to show any emotion at all. Okay. Sometimes it's their personality. Sometimes it's because they're being neglected. You know, could definitely be an indicator of abuse.
Well, and this child that I was talking about, I mean, he doesn't talk. He almost shows no emotion some of the time, and that's why there was a lot of indicators that, I mean, that's what it could have been. But at the same time, he wasn't afraid of mom. When mom walked in the room, he ran to mom. He wasn't afraid of like me or anything like that. So it was a really fine line of what to do or how to go about doing that.
Yeah, it sounds like a report needs to be made, and then you have this other information that's really helpful too. No fear of mom. That is really good information to include. Like, I am seeing these things that I'm supposed to be concerned about, but this is also what I'm seeing that I think are good things. Okay, so here's some more indicators. I've been in houses where kids are like, they've taken knives and stabbed the walls and they've set things on fire. Like we're talking outside of the normal destructive type behavior for kids. And you brought up a good point about the fearfulness. We're going to want to know what their interactions are like with caregivers. So I forgot to give the institutional example. Physical abuse is pretty obvious if one of the daycare staff, you know, injures a child in an active discipline, which I would imagine you're not allowed to discipline kids hands-on at all. But sometimes with institutionals, it's a licensing issue, and sometimes it's abuse or neglect. Okay, so you have a daycare staff that is, you know, I don't know, spanking a kid. There's no injury. That's going to be licensing, okay, because it's not abuse. But if you have daycare staff causing an injury from an active discipline, then that would be abuse. I have never seen emotional abuse coming out of a daycare, but you know, I'm sure it could absolutely happen. You know, I've only been around for 5 years. I'm sure it has happened. Okay. So emotional abuse, like I said, is this gray area, and it's not just name calling. You guys have any questions about that? Okay. We're going to move on to sexual abuse, the key one that no one really likes to talk about. So we do have sexual abuse happening in institutions. Okay, that's when a daycare or you know, a staff member, we had a staff member out at Grand Mesa Youth Services Center having sex with children. So that would be, I've gone out in daycares for sexual abuse, for the provider sexually abusing kids. So that's the provider sexually abusing a child. Okay, that would be an institutional. You also have these other behaviors where you have like the kid-on-kid type of sexual behavior. Okay, so if it's kid-on-kid, as far as an institutional would be concerned, that could be lack of supervision, depending on the circumstances. So kid-on-kid is not going to be like a sexual abuse. In an institution, it's going to be a lack of supervision. As far as the family side of things, we can start charging kids at the age of 10 criminally for sexual behavior. So think of your little 10-year-old going to DYC. Okay, it happens. All right. So if you have a 10-year-old perping on a younger sibling in the home, it would be sexual abuse. You have mom's boyfriend perping, that would be in our realm of what we would investigate. You know, bio parent. If you have uncle who doesn't even live in the home, that's also in our realm of what we would investigate. So, yeah, sexual contact between caregiver and child. Sexual abuse is going to be investigated jointly with law enforcement because there are going to be criminal charges coming as well. Okay, so law enforcement's going to determine if there's charges. child protection is focused on, is this child safe? What steps do we need to take to make sure the child is safe? For indicators of sexual abuse, these are not likely to be found, right? Because it can take years, it is normal for it to take years for kids to disclose sexual abuse. They're going to disclose when they are with someone that they feel safe enough to tell. Sometimes they'll tell their parent, and their parent will be like, that didn't happen, you're a liar. Okay, so if that happens, then it's even going to be harder for that child to disclose what's happening. Injuries to the genitals, you're not going to normally see those because your genitals they heal very, very quickly. Like if you bite your cheek, it's really similar to how quickly your cheek will heal. If you guys are doing diaper changes, I would really hope that you would make a call if you were seeing any of this stuff going on. And sometimes we have kids with STDs, sometimes we have incest, pregnancy from the sexual abuse.
So, when I change diapers, I mean, I don't even know what it looks like in an adult for like a sexually transmitted disease. Babies get diaper rashes, and sometimes
Right.
it's a series of blisters or bumps. Or so, what would you look for? What would be an indicator of possibly an STD in a child?
So if you are seeing, because sometimes even that diaper rash can get severe enough that it bleeds.
Yeah.
If you're seeing blood coming from the genitals, okay, that's not normal. If you're seeing like a discharge that's coming from the genitals that's very smelly, I mean, that's going to be an indicator of an STD. Some kids are very fixated on masturbation, right? Always have their hands down their pants. If you feel like that's falling way outside that bell curve, that can be a reason to make a report, okay? There's normal sexual behavior for kids, and then there's outside of that norm, okay? So it's not uncommon for people to find a couple 5-year-olds in the closet, you show me yours, I'll show you mine type of situation, right?
Or humping like a blanket or a bed, right? Could be normal.
It
To
could be.
soothe, self-soothe,
Yeah,
to go to sleep.
I've taken reports on a child doing that like non-stop. They can't be redirected, like the behavior is way outside the norm. But yeah, I mean, sometimes that is when kids are masturbating, is when they're trying to go to sleep. But if you have, a 5-year-old, 6-year-old that is focusing on like younger kids or even same age kids, and they're like, inserting objects and performing oral sex, and that's way outside the norm. Okay, so that's going to be something that you're going to need to make a report on. There we go. Okay. So like I said, sometimes you're just going to have a child disclose to you about sexual abuse. We don't want you to go into like an interview if you do have a child telling you about sexual abuse, okay? It can cause real problems down the road with prosecution. We really just need to know the basics. Like, a lot of times kids will just point. They won't even say the word because they're too embarrassed. And they'll say, so-and-so touched me, down there, or something like that. So really we just need to know that it is sexual abuse, and I'm going to definitely want to know who the person is and if that person is in the home, because that's going to significantly change how we respond, right? Because if it's sexual abuse and the perpetrator and the victim are in the same home, we're going out right then. It's an immediate for us, okay? But if it's like, it's dad and it happened and they visit dad like every other weekend, we're not going to go out immediately. But like I said, we're going to coordinate with law enforcement. We're going to set up a forensic interview. They'll determine whether it's enough to press charges. We'll do our thing, law enforcement will do their thing. So sudden behavioral shifts. I'm sure that you've seen like sudden behavior shifts in kids before. You're like, what the heck happened? Well, what the heck did happen, right? Has there been a change in who's in the home, or are they? Was there a death in the family? Like, what has caused this huge behavior shift? Like, we want to know what's going on there. Delinquent runaway behavior. Sometimes teens are just wild. Sometimes there's something else going on. So this is the criminal statute for child abuse. So all of those pictures that I was showing you, I don't know that law enforcement would have been involved in any of those because they were all considered like at a minor level. So when we get like, black eye, bruising on the butt from a belt, we're not investigating those kinds of things with law enforcement. They're not even gonna get involved in something like that.
Even the burns on the baby.
They probably get involved
So
in burns.
where's that line where they do get involved?
It has to be more than a minor level, so requiring like medical attention.
Got it.
So like nothing happened to those parents in a way?
No, something happens to the
Okay.
parents.
Okay.
It's gonna be through the child welfare path,
Gotcha.
not the criminal. Sometimes they're getting both, sometimes they're just getting one. Okay, so we've gone over all the abuses. Any questions?
Well, not really a question, but we used to do foster care, and when we would, go to these kind of things, they talked about using appropriate terminology, because one little girl tried to disclose to a teacher, my daddy ate my cookie. And
Oh.
they were like, "Oh, that's so nice! You shared your cookie with your daddy." You know what I'm saying?
Yeah.
And it was they were
Something totally
trying
different.
to say something,
Yes.
right? And so it was really big on using the proper terminology, even though in daycare you're not really, are we really allowed to talk about it?
Right.
Vaginas and penises, I
Right.
don't know. So anyway, and that could just go with age appropriateness, just kind of. I know you don't want us to investigate, but if they say that, then you're like, what kind of
Tell
cookie?
me about your cookie.
Tell me about your cookie.
What's this cookie
Yeah,
about?
yeah, I mean, I don't know,
Yeah.
but, and that's super hard too, because they're trying to secretly tell you,
Right,
and you're trying not to be, intrusive, but
yeah,
you really don't want to say good for you, because then they think, oh, you're supposed to be
right, yeah, that's creepy.
Yeah.
There was a sex abuse investigation, and this little girl, she told somebody, my dad peed on my pee-pee. Okay, so that sounds really, really concerning, right? What happened, she's potty training, she pees in the toilet, she doesn't flush, her dad pees in the toilet.
Oh, God.
Okay, so there are these like types of situations, that's why they have to be investigated, because you have to figure out what's happening. But yeah, that's a good one, definitely, thank you for bringing that up. Kids are saying that, maybe ask a little more about that. Alright, so we're gonna move on to neglect. Like I said, neglect is kind of everything else that we'd be concerned about that isn't falling under abuse. We spend a lot of time talking about this prudent parent, and your definition of a prudent parent is probably gonna be a lot different than how the law defines this prudent parent standard. So I kind of equate it to like the grading scale, like you have your A parents, you have your B parents, you have your solid C parents, you got your D parents.
Do have those.
You got your F parents, okay? So we are talking about minimally adequate parents, okay? And the standard is probably not what you think it should be, but it's just providing those very basic needs. I had somebody in the police academy actually ask me, is it emotional neglect, which there is no such thing as emotional neglect, if you don't give your child enough attention. Like there's nothing in the law that says you have to love your child or even like your child. Okay, you just have to provide for those basic needs. Okay. So, deprivation of necessities, like I said, those are those basics. Okay, so homelessness in and of itself is not necessarily neglect, because we have families that are staying in the homeless shelter at night. They maybe go to the Catholic Outreach for food during the day. They have a warm place to hang out during the day. All those basic needs are being met. Maybe it's not neglect, okay? Same situation, you have them living under the bridge in December, those basic needs are not being met, right? Freeze to death.
Does that happen here? Because I don't think I've ever seen like a whole family on the side of the road.
I believe it.
I know.
Oh my gosh.
I know when I worked in the school district, we had families that would come in and get registered for school, but yeah, absolutely no address, because Fifth Street Bridge is not really
Right.
an address.
Right. Yeah, we've had to remove kids because of that type of situation. Okay, so I've never seen deprivation of necessity in an institution, but it could happen. Yeah, you could not pay your electric bill or water bill, or I don't see that happening. But here in this nice place.
Yeah, that's right.
Environment injurious, that is this really big umbrella, because this includes substance abuse, domestic violence, dirty home, right? Like some type of environment that is injurious to the child. Okay, so you have your meth lab, you have the hoarder house, it's got the poo all over the place and the little